Okay, we're going to finish up our lecture on functional imaging techniques, and the last fMRI technique we're going to discuss is MR spectroscopy, MRS. With MRS, we are obtaining biochemical information about the chemical components and tissues of the human body in a non-invasive way, so we are able to cut out biopsies. In MRS, we're producing a spectrum as opposed to an MR image. And this spectrum is going to be a plot of signal intensity versus frequency, or more specifically, precessional frequency. We're going to be visualizing the chemical shift of these metabolites and their difference in precessional frequency. So you can see here I have a spectrum of two tissues of water and fat and their chemical shift between those two tissues at a 1.5 Tesla magnet. And we know that they precess at different speeds, and just due to their characteristics, water precesses faster than fat around the static magnetic field, and it actually precesses at 220 hertz faster than fat. And the metabolites that we're going to be looking at are actually going to be under this water curve. So we're going to have to find a way to eliminate this water curve so that we can visualize the chemical shift of these metabolites. Chemical shift is caused by having difference in precessional frequencies of tissues around the static magnetic field. And these tissues are made up of atoms, and the atoms have a certain amount of electrons in their orbiting shells. And depending on how many electrons they have in those orbiting shells, it will change how those particular tissues react to the static magnetic fields. They might be more attracted than, say, some other tissues. This chemical shift is measured in parts per million. That is going to be its unit, and that is abbreviated by ppm. So make sure you know chemical shift is always going to be measured in parts per million. And chemical shift is going to increase with field strength. So going back to our original plot here of water and fat, this is at a 1.5 Tesla magnet, but if you happen to be scanning on a 3 Tesla magnet, these peaks of water and fat are going to shift actually further apart. They're going to separate a little bit more because of how the precessional frequencies are going to change now that you have doubled your static magnetic field. So instead of it being 220 hertz apart, they're now going to double, and it's going to be 440 hertz of a chemical shift between fat and water. Okay, there are two types of MRS, single voxel and multivoxel. So we'll talk about single voxel MRS first. And with single voxel, we're going to be using 3 intersecting slices to locate a single voxel from which to measure this spectrum. So with most pulse sequence, we're going to be applying these time-varying gradient magnetic fields, but that is not the case with MRS. We do not want to change the static magnetic field at all, because that will change the properties of these metabolites and their chemical shift. So we're not going to actually be applying any gradients, specifically the phase and frequency gradients. We're really just going to locate a single voxel by using 3 intersecting slices. So we're going to center that voxel over pathology. We're going to find that pathology, and we're going to center it over it using all 3 orthogonal planes. And we're also going to use an additional voxel, or control voxel, where we're going to center it over the same region of the brain, but on the opposite hemisphere, which should be normal tissue. There are 2 types of single voxel MRFs. There's STEAM, which stands for Stimulated Echo Acquisition Mode, and PRESS, which stands for Point Resolved Spectroscopy Spin Echo. And then I put down here, it's an important reminder for us as technologists to make sure we shim our scanner before we actually run this sequence, so that the static magnetic field is as homogeneous as possible. And that's, once again, a good reminder that we are not going to be applying any time-varying gradient magnetic fields. And then we need to make sure that we suppress water before we start our pulse sequence, because, once again, these metabolites and their chemical shift is actually going to be under this water peak. So we need to be able to visualize these, and the only way that we're going to do that is by suppressing water. Okay, here's a image of single voxel MRS, and you can see here we have located the pathology, and we have placed our single voxel over the pathology, and our control voxel over the same region of the brain but on the opposite hemisphere. So we go ahead and we scan each voxel, and then it produces the spectrum. You can see here we have all the metabolites, and they have their individual peaks. And you can see that there's going to be a variation in those peaks. Some are going to increase, some are going to decrease, depending on what's going on in the body. And I want you guys to take note of this particular metabolite, Na or NAA. And you can see here from the normal side, the peak is a little bit higher. And then on the pathology side, it has dropped down. And that is an indicator of tumor cell invasion. Okay, now the other type of MRS is multivoxel. So instead of just one voxel, we're going to be using a grid of voxels over healthy tissue and some over the pathology. So each voxel within that multivoxel MRS is going to produce its own spectrum. This is going to be more time efficient. You're going to have greater signal from these images, which will produce a little bit more accurate spectrum. And we're going to be acquiring these multivoxels almost in the same manner as we encode K-space for conventional MRI. So you can see here, instead of just one voxel over healthy and pathology within the brain, we're going to get multiple voxels. So it's going to increase the amount of time, but we're going to get more information. So you can see here the pathology is in the right posterior lobe, or the occipital lobe of the brain here, and then you have some of the voxels over normal healthy tissue. So you'll get a spectrum for each one of these voxels so that the radiologist can do some comparison of those metabolites and see which peaks either grow or decrease in size. So when reading these spectrums that are produced as you scan, you're going to be able to, it's possible to compare relative amounts of each single or multivoxel spectra to determine the disease process. So this is going to help, when determining the diagnosis. We know that there is pathology there. Now we need to specify what type of pathology it is exactly. So changes in these metabolites and the sizes of their peaks sometimes indicate tumors. So like I said before, if we have a drop in NAA, that's an indicator that we have tumor cell invasion. If we have a increase in choline, that is an indication of tumor growth. If we have any changes of lactate, that's an indicator of anaerobic status. And if we have an increase of lipid, we have that's an indicator that the tumor is necrosing, which is good. So here's just a little chart of what some of these metabolites mean and what helps the radiologist make those diagnoses. And then I provided a chart or a list of these metabolites to kind of go into a little bit more detail about describing what they are and what happens and what kind of indicator it is if one of these metabolites increases or decreases. So I'll let you guys read these on your own. So some uses of MRS, we use MRS in conjunction with conventional MRI. It's used to help plan therapy. It's good for biopsy guidance. It's very useful in aiding in prognosis, how well or bad a particular patient is in regards to the diagnosis that they were giving. It's good for monitoring therapy, either chemotherapy or radiation therapy. It's helpful for staging stroke or tumors, specifically in the brain, prostate, or even in the breast. And sometimes it's used to diagnose and understand these disease processes like depression, epilepsy, and schizophrenia. So here is a MRS study of the breast, and you can see that the tumor, when originally scanning, was this size at 18.6 cc. You can see it's very large on this sagittal scan, and you can see the choline, T-choline metabolite level is relatively high. But as this cancer is being treated with either chemotherapy or radiation therapy, I don't know exactly what type of treatment was used, you can see as they scan after these treatments, the tumor size does start to decrease to the point where it gets down to undetectable, where the tumor has actually gone down to 0 by day 84, and then you can see that the T-choline metabolite level has dropped down considerably. MRS is also useful for when we're scanning the prostate. As you can see here, you have the spectrum being produced as they are looking at the prostate and that prostate cancer that is starting to seep into the bladder here. So it's also sometimes color-coded, but you can see here's a T2 weighted image, here's the ADC, and a B-value diffusion weighted image over here on the right. But once again, it's helpful in prognosis of certain cancers of the prostate gland. So that wraps up our lecture on functional MRI, and specifically the last little bit on MR spectroscopy. All right, thank you.